for business, and thank you for your time. We know you have busy schedules, so we won't keep you much beyond the presentation and a Q&A period that's available. On behalf of the many chambers that gather to do this together, it's really a pleasure to work with my colleagues up and down the Fox River Valley. So I'm going to mention those at this point in time. The Chambers of Commerce with Geneva, and you can wave hello, folks. St. Charles, Huntley, Bartlett, Hampshire, Elgin area, Algonquin, Lake in the Hills, Cary Grove, Batavia, and Northern Kane County Chambers of Commerce. So thanks to all of them. And of course, thanks to Michael Isaacson and the Kane County Health Department. Obviously, there's a demand for information relative to vaccinations in this county, and it's just so exciting to hear of additional resources being made available and locations being made available. So we're just really pleased to introduce at this point in time Michael Isaacson with the Kane County Health Department. Thank you so much for being with us once again and giving us an update.
Sure. Thank you, Carol, and thank you everyone for the invitation. So I have a mix of good news and some trends that we're actually pretty concerned about here. So a lot of good news. I'll focus on that, but you know, it's similar theme over the last couple of weeks and even the last couple of months where we're making progress, but we're not at the end yet. So I'll just start with our test positivity. So this is a measure I share in most presentations. Typically, I share a 30-day look, but for this one, I've gone ahead and put the data on from back in the summer. And this is for Kane and DuPage County, the percentage of people who get tested for COVID, what percentage of those are coming back positive. And I just put this longer view on because unfortunately, it just shows the scale of the increase that we've been seeing over the past month or so. So you can see from our peak in December, January, we dropped down. That was really fantastic news. But over the last few weeks, the last 4 or 5 weeks, we've almost doubled in our test positivity. So we're still lower than we were a couple months ago, but we're definitely headed in the wrong direction here. And again, this is a message that we have all been sharing really for the past year, but wearing the face coverings and still practicing social distancing. So what does this mean for employers? We don't want to bring everybody back for in-person meetings crowded into a small room. We don't want everybody sitting around the lunch table just because, you know, 2 out of 10 people may be vaccinated in the office. It doesn't mean everybody should relax. We still need to be very careful. So this test positivity is really concerning. And again, the test positivity sometimes is the first thing that we see start to increase, followed by hospitalizations and deaths. So this is like the warning when the positive tests go up. On this next slide, and again, this is for Kane and DuPage County in what we call Region 8. This is looking at hospitalizations. So this is not currently as alarming. We're definitely and this I just showed a month because I think it's more relevant for this discussion. So the little blue dots show days that we've increased. So we're right around the same number of people in the hospitals as we were a month ago. So, okay, that's not bad. We're kind of stable there. But unfortunately, over the past 2 weeks, we've had small increases almost every day. So we're going the wrong direction. You know, warning bells aren't going off yet. It's a slow increase. We're seeing some people who are younger and healthier, obviously sick enough to require hospitalization, but fewer people in the ICU, fewer people on ventilators. But still, this is concerning. So we do want to make sure people are aware of this. In terms of deaths, again, this is showing from last summer to now. This particular chart is looking just at Kane County, and we've kind of leveled off here over the last couple of months. So we're averaging about 1 death per day. We'll know when people talk about, you know, how do we know when we've reached herd immunity? How do we know when we've, you know, when we're on the other side of this? This is ultimately, I think, the most important thing, right? How many of our friends and neighbors and family members are we losing to this disease? And right now, it's still 1 person per day in Kane County is dying from this disease. So still a lot of work to do. So that's kind of the bad news. The good news is our capacity to get vaccine out to people continues to ramp up. The supply is getting better all the time in our community. So you can see on this chart, we have 245,000 shots have been administered to Kane County residents. The way this data is reported, it's based on where people live. So it doesn't matter who gives it to them or where in the state they get it. So that means if a Kane County resident goes down to Peoria and gets their shot, that counts here. But also it means that if somebody in DuPage County or McHenry County gets their shot in Kane County, that is reported on the person's home page. So this is not a true reflection of all the work that's going on, but it shows exciting progress, I think, with the number of people who have been immunized. You can see with this orange line here, this is the 7-day rolling average for number of people who've been vaccinated. So we had a little dip with vaccine. People probably saw in the news there was some snafus with the manufacturing of the Johnson & Johnson vaccine, which also you may hear referred to as the Jansen vaccine. So we had a little dip there, but I think our numbers over the next couple of weeks should be picking up. So we're getting about 4,500 people vaccinated each week, or each day, I'm sorry, in Kane County. So we're making good progress, but we have capacity to do a lot more. If you have been listening to these updates since January, February, you'll remember back when there was a time when I was saying our initial goals were to get up to 3,000, 4,000 people a day. So the good news is now we're getting there. We've met those initial goals and we're able to ramp it up even more. So really good progress. This is exciting to me. 90,000 residents are fully vaccinated. So that means they've either had the 2 shots of Moderna or Pfizer, or the 1 shot of the Johnson & Johnson vaccine. So that's just about 17% of the total population. Again, that's not necessarily the people who are eligible for the vaccine, because Pfizer is only available to people 16 and over, and the Moderna and the Johnson & Johnson are only available to people 18 and over. So there's about 100,000 people who aren't even eligible for the vaccine. So when you take them out of the equation, we have much more than the 17% who are fully vaccinated. So a couple of things that I can report on. We did open the site in Batavia. What was it? Not quite a month ago, about 3 weeks ago. So we're probably closing in on 35, 40,000 people have been vaccinated there at that site. So that's exciting. We do have on our canevax.org site where people can make appointments, and I'll show a little more of that in a moment. People can also call 855-4-CANE-VAX. And just if you're looking, the X is an extra number, so you can dial it and it doesn't hurt. But if you're trying to figure out how many digits it is, it's 1 extra digit on there, just so we could make it a little bit easier for people to remember. So it's 855-4-CANE-VAX. And then we're excited, we, in partnership with the city of Aurora, we're able to open a site on Lake Street or Route 31 in Aurora on Friday, April 2nd. And then just yesterday, we opened up the site in Elgin. So now we have 3 mass vac sites serving Kane County residents. They're actually open to anyone in the state of Illinois. We have support from the National Guard. We have contract nurses that are being supported through the state, as well as we have our staff who's been working very hard to keep these clinics running. We have a fantastic medical reserve corps, and the medical partners in the community continue to step up and provide resources to be able to get vaccine to people. So 3 sites where we're able to administer vaccine. None of these are working at full capacity yet. We still don't have all the vaccine we'd like to see. So as more becomes available, we're going to be able to make even more appointments available for people. Also, we're continuing to work with community partners like VNA Healthcare, Greater Elgin Family Care Center, the hospitals, to do special clinics for specific hard to reach populations. So that is continuing on an ongoing basis. And then for workplace vaccine clinics, there's a couple of paths. I still encourage people to reach out to pharmacies and see if you can get something set up on site if you'd like people to actually come to your business and provide vaccines. And then here at the health department, we continue to work with the Illinois Department of Public Health's equity team. And what we have focused on, how we're prioritizing, is we're looking at employers with more than 100 people so that we can have a good chunk of people on site, and really starting with organizations where we've had outbreaks and higher risk in the past. We're starting to work through that list. I've always been hesitant to collect a list of all the businesses who want on-site vaccine, just because I don't want a list of 500 names that I know we're not going to be able to get to everybody. But as we work through this list, we may be reaching out soon, and we'll reach out through the chambers if there's more opportunities that become available for us to bring in these state sites. Also, we are going to reach the point, and I think it's possible it could be soon, where we're not getting the high demand for vaccine, but rather we're going to need to go out and be encouraging people to come in and get the vaccine. That's going to create more opportunities for us to do things with specific employers as well as we move forward through that. Here's a look at what our vaccine page looks like now. We've made some changes. We're constantly trying to make this process a little bit easier. It's still a bit frustrating for several reasons, and we're aware of some issues that people are running into. Number one, people are frustrated if they want an appointment and they can't find one. So there's not a lot we can do about that other than just asking people to be patient. But what we have done is we've tried to clarify which vaccine is going to be available. So the way the page is set up now, you come, you choose your vaccine location. So you can look at Batavia, Aurora, or Elgin. You click on that tab, and that's going to open up the bottom piece here specific to that location. So on here, if I clicked on Batavia, I can see, okay, what's today? Thursday. We're offering the Jansen vaccine, the Johnson & Johnson vaccine, from 9 to 6 today at that clinic. So people will be able to go. And then tomorrow at the Batavia clinic, we're going to be offering Pfizer all day. So if people have a preference, they're going to be able to look here and see. A couple of other issues that we've run into are just, and this, I should clarify, this page, the health department completely controls, or Kane County completely controls. Once you click to make an appointment, that's going to shift you over to the state scheduling page. We make appointments available on that page, but we don't have total control over that system. So a couple of things that you may hear about that are causing people frustration. Number one, you can, and actually maybe I'll escape out of this, and I'll go to the site and actually show it in a moment here. Well, yeah, let me just, because I think this is the last reminder that we want people to wear their face coverings. People have probably seen this 1,000 times, but it's still very important. I'm going to stop sharing and then I'll start sharing again, just to show what the actual site is looking like. Okay, so if you go to the Kane Vac site and you look here and you say, okay, I want to get an appointment in Batavia, you click on Batavia, and then I click here to make an appointment. So sometimes, depending on what day it is and how busy it is, people may be in a waiting room. Typically, it's only a minute or two. If it's a day that is really busy, because this is a statewide system, I've been in this waiting room for as long as 30, 40 minutes before, because there's a lot of demand. So it pops up. That wasn't too bad a wait.
You think they would have given you a little leeway on this and just let you
Yeah,
pop in?
no, yeah, and I feel people's pain on this because our hands are tied a little bit. So we're trying to figure out how to make this as user-friendly for people as we can. But yeah, I don't have a lot of extra access. So number one, I click on this and they're all red because the appointments are full. So number one, that's frustrating to people, but that's just reality, right? Demand is higher than supply, so that makes sense. But something else that can be frustrating for people is on April 13th, I look and I say, fantastic, there's an appointment available at 11:30 a.m. So I click on 11:30, but if I'm looking for my first dose, fully booked. So what the green box means is somebody can get in for their second dose and they'll have a voucher code that they can use, which they'll get when they get their first dose. But if I go back, I don't know, as a resident trying to make my first appointment, which of these, they're green in my mind, that means there's vaccine available. And right now we don't have a way where we're separating to be able to tell these are first doses or second doses. So we appreciate that that's causing people some frustration. We're working with the company, we're working with the state to try and clarify that, trying to see if we need to set up 2 separate clinics. So we have one that's called first doses and one that's second dose. So if you are hearing some concerns from people, that is what the issue is there, is that yes, there's a dose available, but that spot may be held for somebody that needs to come in on that day to get their second dose. And if they type in a voucher code, they can redeem the voucher code and now I can access that second dose. So that'll be available. So that is where we are right now. So again, really exciting in terms of the amount of vaccine that's getting out to people, but really concerning that these rates are going up like they are. We had, well, yesterday we had triple the number of cases that we had a couple of weeks ago. So definitely going in the wrong direction as far as that's concerned. And I think it's just because we're all, and I mean, I do feel like a broken record because I think I said this in probably March and February and January and December too. We're all ready to go back to normal. So you see people getting together in big groups and lots of people are traveling. I have lots of friends and family who have traveled and you know, I hate to be the nitpicky public health person, but and I know people are going stir crazy, but we're just not quite ready to have everyone going out and being in groups yet. So with that, I'll open it up to questions. I think, I mean, again, I want to end on a positive note. We're vaccinating a lot of people every single day now. So that we are working through this. We are making progress, you know, 200,000 plus vaccines. Like I said, those are real numbers now. It's not like at the beginning where we were doing a few thousand a week. Now we're doing that every day. So I'm really optimistic about where we're headed still.
Hey, Michael, I've got a question.
Sure, Paul.
Okay, between the people who are testing positive, which I really don't want them to, and the amount of people that are getting vaccinated, is that going to help our herd immunity and make that go a little quick? I mean, I know it's spring break.
Sure.
Everybody was out and about and could care less about anything for spring break. So I knew there was going to be a big thing, but won't that help our herd immunity a little bit? I mean, I don't want them to die, but
sure.
Yeah.
No, that's never, I mean, the simple answer is yes, but that's never a strategy I would want to take, right? So, you know, once you've you know, if you get measles, you don't have to worry about getting measles again. But it's not an effective strategy to say, well, everybody should just get it and get it over with, which I know is not what you're saying. But yes, every time somebody is getting sick, there's a risk, but they should have some natural immunity now for several months. And we're still learning how long that's going to be. And I think for the big spike that we saw in December, January, that was a combination, I think, of a lot of people probably having immunity after being testing positive, or even if they didn't, even having the illness, not necessarily even if they were not tested. So yeah, I think your point's well taken.
Well, and Stu, I mean, when do we reach herd immunity? I mean, it's just like here you have people who will have they got their, you know, vaccine in December, but now it's only saying they last for 6 months. So does that take them off the herd immunity list? Do you know what I mean?
Yeah, no, absolutely. And we don't have the specific answer for what percentage of people we need for herd immunity yet. There has been 2 really good pieces of news for both Pfizer and Moderna that their 6-month protection is looking really quite strong. So the specific questions about what do we need for herd immunity, how long do the vaccines last, are we going to need boosters, et cetera, we don't know the answers to those yet. But I think the things that are going to be really telling are when hospitalizations and deaths are going down, and when people are no longer getting ill and testing positive, that's how we start to see that herd immunity is working, because there's actually less virus circulating in the community.
Michael, a question about our stages and being in phase 1B plus. We allegedly are supposed to go to any resident ages 16 and up next week. Is that right, on the 12th?
That is correct. Yeah, it's not even allegedly. Yeah, we're
Okay.
on Monday, we'll be opening up, and I'm sure the governor will make a big announcement. So in Kane County, because we're doing these sites in partnership with the state and the National Guard, we will be opening up to all residents 16 and over.
So then phases are out and it's just open to anybody that might need to receive a vaccine. Okay, good.
Exactly.
I
And
appreciate
I
that.
should say the preliminary research with the younger people is looking really positive too. So we're hoping to get school age kids, that the approval will be sometime, maybe even over the summer, where we can get them vaccinated as well.
Excellent.
Michael, have you heard anything about people who are vaccinated are not counted in the total amount of people attended at events? Could you comment on that?
Sure. So that is in the guidance in terms of, we still want people to distance and all those kind of things. So you have to dig into it a little bit. I think the CDC does a pretty nice job describing, here's how you can behave if you've been vaccinated. In terms of you're able to hang out with other people who are vaccinated. You're able to go to maybe one household where people aren't vaccinated. But in terms of being in public or in the workplace where there's a mix of people who aren't vaccinated, we still want people to be careful, and we want people to be following social distancing and wearing masks, including those people who are vaccinated, because we're still, and I think this is being conservative, but we're still concerned about people who are vaccinated potentially spreading the disease. I think as we get more and more data, that's looking less and less likely, but we still are taking a conservative approach to that. And then specifically to your question, when we are looking at some of these capacity limits, people who are fully vaccinated are not counting towards those capacity limits. Of course, that opens up a whole another set of issues in terms of, well, how do you know who's who? My understanding is hopefully, well, this is state time, so it's kind of like counting in dog years. So soon we should be hearing more about what the state may propose for the passports. If we're going to move forward with that type of thing in Illinois, just to kind of help us. So if you're running events or businesses and different organizations are running events, so that we have some kind of way to know. But of course, there's a tremendous amount of conversation about privacy and things like that people are raising right now. So tricky. And I'm even, right prior to COVID, the whole issue with just vaccine hesitant parents, and there was a lot of debate about people who weren't vaccinating their kids, and then they were bringing their kids to be around other people's kids, and that was really alarming to parents. So that it's all kind of a continuation of those discussions. It's like, oh, I'm making a personal choice for me, but it does impact everybody around me. So where as a society are we going to land on that? I'm not quite sure yet.
Thanks, Michael.
All right. Any other questions of Michael while we have him here?
Please, Michael, this is Tom Ellis. Thank you for your time.
Sure, thank
You had mentioned during part of your presentation some advice for small businesses with less than 100 people who might still want to try to organize something of a group approach. Could you speak to that just any more in terms of either advice or specifics as how you've seen it be successful?
Yeah, absolutely. So I would not want any business to just sit and wait for us. So that's why I've been a little more conservative in terms of getting a list of employers, because I know we could get a list of hundreds of people the first day. So I encourage people to look for other avenues if you are interested in trying to get something set up on site at your workplace. So Walgreens, CVS, Osco, they are going out in the community and doing clinics. In some cases, we provide them the vaccine to do that, but in many cases, they're using vaccine that they're getting directly either from the federal government or the state, so it doesn't even come through the local health department. So it does add some complexity in terms of having to look in different places. But like I said, you may be able to get somebody to come on site next week. So I wouldn't want to defer you from that. As we move forward, what we've had the most success with is the Illinois Department of Public Health's Health Equity Team. So because they are looking specifically with a health equity lens, that, you know, the criteria is a little more rigid with that in terms of looking at larger employers who have a more diverse workplace or makeup of their employees. And then, as I mentioned, we're really focused on places where we've seen risk and outbreaks previously. But I think we're getting through a lot of those places. So I still don't really want to get a list of businesses just because I know we're not going to be able to get to everyone on the list. But I think over the next couple of weeks that we're going to be able to free up more opportunities. We're just not quite there yet. Okay.
And if you were to reach out to an OSCO, you're reaching out to a specific OSCO, and is there a leader in those businesses, or do you just say, I want to speak to someone who can coordinate group vaccinations? Any advice as to how to kind of get to the right person?
No, not specifically. I think what you started with is probably the best approach. And just being totally transparent, I'm wary, and I don't think it would be appreciated if I just gave the regional person's email, because it's not going to help them to have 600 businesses contact them. So I'll kind of defer that to you at the local level. And if you have relationships with an OSCO in your community, that may be the fastest way to make it happen. We certainly have the contacts that we work with, but they would simply be overwhelmed and wouldn't be able to respond to everybody if we all contact. If we make it a formal process, it'll kind of paralyze the whole system, I think. If that makes sense.
No, that's great. Thank you very much.
Question too about the vaccine cost. If you are going to an FQHC or to a vax site like the ones in Aurora, Elgin, Batavia, there's no cost to the recipient. Is that right?
Yeah, there shouldn't be a cost to recipients for the vaccine anywhere. People do have the right to bill your insurance for an administration fee. So you may go some places, if you go to a pharmacy, they may ask for your insurance information so they can bill it, but you should not have to pay anything out of pocket. And at the mass vac sites that we're running in partnership with the state and Elgin and Aurora, we're not collecting insurance information.
Good. I appreciate that update. That has been a question that we've heard from some folks. So thank you. Any other questions from the group today?
And I know we just announced the bridge to phase 5, maybe a day or two before the numbers started ticking up. So just a quick update on that. So we're well over the 70% number of seniors being vaccinated. So we met that first mark to get to the bridge. So all we need to do now is kind of bend down the curve a bit on the hospitalizations. The state's put it forward that they're looking at these on a 20-day average. I think there's some subjectivity from the governor's office in terms of when they're going to choose to say, yes, now it's okay. So in terms of the number of people vaccinated, we've done great. We're there. So as soon as the numbers improve around hospitalizations, I think that's where we'll be able to start talking about actually getting on the so-called bridge to phase 5, where capacity limits can open up. And I know being in this kind of limbo makes it really hard for people to plan for the summer, depending on the type of business, because I know we have a lot of gatherings and events that people want to do. So I'm hopeful that this is a short little blip with this increase in cases and hospitalizations. And as we get more people vaccinated, that we're able to bend that back down.
Terrific.
Hey, Michael, how long did the December, I know there was a big blip in December with the holidays and that, how long did that last? Can we kind of figure that with spring break, it might be the same time frame?
I don't think we can perfectly predict it because we didn't see the huge spike necessarily from Christmas like we thought, or the kind of the December holidays like we thought we may. But it was about a month where it was pretty bad, and of course we were building up to it and coming down, so it was pretty bad on both sides too. But in terms of that peak, I think that's what we'll look at. And kind of to the comment you made before, if a lot of people have just recently been ill, there's a lot of people floating around with immunity. So we have both the vaccinated and the recently sick that shouldn't be spreading the virus anymore. So hopefully we'll be able to turn that around quickly.
Thank you.
Well, Michael, thank you for your time. We appreciate your time and your expertise and certainly the presentation. You've always been so gracious in giving us that time. Thanks to the folks for joining us. We will go ahead and close this meeting and hope that you will remain well. If you have any questions, please go to your local chamber. This presentation will also be recorded and sent to the local chambers. So if you know of anyone who wasn't able to join us, please let them know that that's available to them or will be shortly on the websites of all of our peers. So again, thanks, Michael. Appreciate your
Thank you,
time.
Michael.
Thanks everyone for joining us today. Stay well.
Thank you, Michael. Thank you, Carol.
Thank you.
Thank you.